Simplified summary, macrolides. Common drugs. Azithromycin. Clarithromycin. Erythromycin. Mechanism of action. Bind to the 50s ribosomal subunit. Block translocation during protein synthesis. Bacteriostatic, slow bacterial growth. Clinical uses. Atypical pneumonias, example Mycoplasma, Chlamydia, Legionella. STIs, example Chlamydia trachomatis. Streptococcal infections in patients who are allergic to penicillin. Bordetella pertussis, whooping cough. Side effects, mnemonic, macro. Motility issues, GI upset. Arrhythmias, prolonged QT interval. Cholestatic hepatitis, especially with erythromycin. Rash. Eosinophilia. Can increase levels of other drugs like theophylline and warfarin. Clarithromycin and erythromycin inhibit cytochrome P450. Resistance mechanism. Methylation of the 23's rRNA binding site rightward arrow prevents drug from binding. USMLE Question 1, Clinical use. A 20-year-old college student presents with a dry cough, low-grade fever, and mild shortness of breath. Chest X-ray shows patchy interstitial infiltrates. You suspect an atypical pneumonia caused by Mycoplasma pneumoniae. Which of the following is the best treatment? A. Ceftriaxone. B. Gentamicin. C. Azithromycin. D. Vancomycin. E. Amoxicillin. Correct answer, C. Azithromycin. Explanation. A. Ceftriaxone, targets typical bacteria, not mycoplasma, no cell wall. B. Gentamicin, not used for respiratory infections, toxic and for only. C. Azithromycin, correct. Macrolide effective against atypical pathogens like mycoplasma. D. Vancomycin, reserved for resistant gram-positive infections, not atypical pneumonia. E. Amoxicillin, like ceftriaxone, targets typical pathogens with cell walls. USMLE Question 2, Side effects and drug interactions. A 60-year-old man with chronic bronchitis is treated with clarithromycin. 2 days later, he reports nausea and palpitations. ECG shows a prolonged QT interval. Which of the following is the most likely explanation? A. Autoimmune myocarditis. B. Direct bacterial toxin effect. C. Increased serotonin levels. D. Macrolide-induced cardiac toxicity. E. Acute digoxin toxicity. Correct answer, D. Macrolide-induced cardiac toxicity. Explanation. A. Myocarditis, not associated with macrolide use. B. Bacterial toxins, not applicable, this is drug-induced. C. Serotonin syndrome, associated with MAO inhibitors or SSRIs, not macrolides. D. Correct. Macrolides like clarithromycin can prolong the QT interval and lead to arrhythmias. E. Digoxin toxicity, not mentioned in the case, clarithromycin can raise levels of other drugs via CYP450 inhibition, but QT prolongation is a known direct side effect.